Another question that we are asked frequently by patients is, how long will my phantom limb sensation last?
There is some differentiation between the pain and the sensation. And sometimes sensations can linger and be non-problematic, but phantom pain is going to be problematic no matter what. Phantom pain will always be a problematic thing if it's occurring.
And that's kind of how I try to tell patients to differentiate between that. You're going to have sensation. You may feel as if there's some cramping, and if it's manageable, then it's most likely sensation. Pain is something that is not getting better. It can bother you at night. It disrupts sleep patterns. It can be very disruptive in life, and you can't manage it.
So the hope with phantom pain would be that it's most acute right after the surgery and it diminishes. And after time, it doesn't occur anymore. Or if it does occur, it's so intermittent that it's manageable in your life. And that it's something that you hope doesn't happen, but happens very, very infrequently. There are different things that can happen in your limb kind of physiologically that can cause problems that will make phantom pain become more chronic or happen more often, or even I've met lots of people who go long stretches of time where they didn't have phantom pain, and then all of a sudden it starts. Now, typically, if that was the case, that'd be caused by what's called a neuroma. A neuroma is growth of your nerve tissue that's abnormal. If that nerve isn't implanted into muscle, if it doesn't have a place, a job to do, some place where it's sending signals and receiving signals back, nerve tissue can grow. Even after an amputation. And if it grows, it can grow in problematic ways that can cause chronic pain. A neuroma really requires medical intervention. There are lots of different interventions for it, but that would be something to talk to a pain management specialist or a surgeon about to find out what your options could be for that.
And there are surgeons who specialize in phantom limb pain, nerves, neuromas. So I definitely say if you're experiencing something like that, medication might be a temporary solution, but it's not a good long-term solution. So try to look, ask the prosthetist or your surgeon first. Do they have any recommendations? But if not, you can find a lot of different things online.
Now, a lot of people mention that phantom pain can typically be most severe at night when they take their prosthesis off. So if you think about the conditions that's occurring in, your limb is inside of a socket all day long with that compression, with a squeezing force on it all day long. As soon as you take that prosthesis off, that squeeze is eliminated. So what happens is the body is going to send fluid down there. That fluid is going to trigger, maybe noticeable swelling, maybe not noticeable swelling, but there's still a rush of fluid to that area, and that fluid is going to cause the nerves to be innervated. It's going to be a change, and so one way that people can do that is by putting compression back on, using a shrinker sock.
So could a shrinker help with that?
Often it does, but it's not always the solution either. The thing about phantom pain and sensation that you'll find is that there are a host of different ideas out there and things that should be tried. If there was one solution for all this, there'd be one thing to try, but there aren't, because some things work for some people and they don't work for others. So the idea is to kind of, whether it's varying heat and cold, whether it's compression on your limb, whether it's massage and manipulation of the area, whether it's mirror therapy, which is kind of taking a mirror between your legs and looking into the mirror while you massage the part that you feel the pain on your other limb, to help the pathway in your brain kind of get the sensation that, hey, there's something occurring here. It's helping.
We talked a little bit about massage. One recommendation I always give to people wearing a prosthetic limb, there's always that point in time where you might get some phantom sensation, some nerve sensation. You're used to going down there kind of touching your residual limb and disrupting the nerves. And all of a sudden we find when we're wearing a preparatory prosthesis or we start wearing a prosthetic limb that I go down there to touch and your limb's inside of a socket now, so we can't do anything to immediately disrupt the nerve pattern. I find that if you can just kind of bounce your leg, your heel on the ground, or maybe tap on the socket, anything to create some kind of vibration in there, that can help with some phantom limb sensation while you're wearing a prosthetic socket.
The last thing is I want to say it's very important to communicate, especially if the pain is affecting your sleep.
Yes.
Sleep's a really important part of your recovery, so if your pain is affecting your sleep, be the broken wheel. Talk to your doctor, talk to your physical therapist, talk to your prosthetist, talk to everybody in your medical team about the issues that you're having until you can find a solution that's helping.